My name is Zach Buchwald. I'm a radiation oncologist here at Winship Cancer Institute, and my role as an oncologist takes two parts. I serve as a physician scientist, so I run a research laboratory focused on how we can integrate radiation and novel drugs to enhance the immune response against cancer, while also treating patients with advanced skin cancers and brain metastases.
Where science becomes hope means to me is a true dedication to the bedside,
to bench, and then back to bedside again. So what I mean by that is when I'm in clinic with my patients and with the residents I work with, a lot of times, unfortunately, we can't offer a cure for a variety of different types of cancer. And so when we see situations like that, those can be very thought-provoking, and we take those questions to our laboratory where we investigate them using animal models and human tissue that we've had the permission of different patients to analyze. And then from those experiments, we can devise new treatments that we bring back into the clinic and test in clinical trials. And I think it's that combination of scientific and clinical investigation that really gives the potential for hope for new cures for cancer. So there are many aspects of my work that I find exciting. I think the thing that excites me most is talking to patients about the new developments and advances we have ongoing in the lab and translating them into the clinic. I think when I talk to a patient that may be eligible for one of our clinical trials, I really love discussing the underlying science and the reason we're doing this, and to get them excited about the possibility that they can contribute to science while also hopefully helping themselves and maybe patients down the line. And I think that's one of the most gratifying parts of my job and also intellectually stimulating. As an oncologist, I come in every day working with some of the most dedicated humans that I've ever encountered. They truly care about the outcomes of their patients, and they want to see them get through treatment, not just for a cure, but to do it with dignity and the least amount of toxicity possible. On a very personal level, in the last 6 months, my significant other was diagnosed with breast cancer. And on that level, I've seen Winship from a very different perspective as both a family member of a patient as well as an oncologist. And I've been even more inspired by my experience as a family member taking care of a patient with cancer.